So I say, here's the data. You see if you test your hypothesis. They tested their hypothesis. The data didn't support it. So they tried to use subgroup analysis that weren't pre-specified. The ethics committee says you can't do that. And so they're not going to publish at all. So what do you think? What would you do?
Why don't they, sorry.
Go ahead.
Why don't they publish negative results?
Why do you think?
I'm not quite sure, but it is difficult to be recognized by the journal reviewer.
It's difficult to be recognized by the
Recognized by a journal reviewer, but I'm not quite sure.
So why don't they want to publish their negative result?
It impacts them negatively.
Yeah.
Their opinion is negative. But I think the solution should be to publish everything,
Yeah.
while stating clearly that some of these trials were done after looking at the data. To me, this seems to be the most fair thing. But of course, then it had to be a collaboration between you two.
Yeah.
All of your names on this thing.
So you would have published the results even of the analysis that was not pre-specified in the protocol.
Specifying that it was done after looking at the data by them.
Do others agree with that? The ethics committee disagreed with you.
Really?
Yes, it felt that because they were retrospective, they shouldn't be published.
Maybe it's a difference in the way science is done.
Yeah. It is a very interesting difference, isn't it? And I think, there's an epidemiologist called Ken Rothman who would agree with you that actually, it would be all right to publish those results, but just to say, these results were done after, these analyses were done after looking at the data. And so even though, we should take them very cautiously, but they could make a hypothesis for future research. Yeah.
I mean, if I was to comment, I would question the ethical behavior of the people, the researchers themselves. But then the obligation towards people affected by these trials, or affected by this medicine in the future, is another aspect of it, I think. So that's
The thing is, it goes both ways, you see, because on the one hand, it just so happens that this team, Dr. Moore, he's the editor of the Journal of Trauma. And his son, he's a trauma surgeon, his son's a trauma surgeon, and the father is the editor of the journal. And so he gets a big audience, yeah? In the United States, it's a very popular trauma journal. Now, if he writes a paper showing that tranexamic acid damages some patients, in his view, so in my view, tranexamic acid damages some patients, and that raises an interesting hypothesis for future research, what will happen is that patients won't get treated. And I think the best evidence is that it's safe and effective. And that it reduces the risk of dying. So it's more difficult, isn't it? If it didn't have any consequence at all, if it was just about science, then I would agree with you. Yeah? I would agree with you that actually get it out there. Get it out there, tell exactly how it is. But it could have a consequence. In fact, I wrote to Ken Rothman about this, and that's where we both. That's where our conversation went to. We said, look, actually, we don't disagree that different. You're more concerned with the consequences. And I said, yes, I am concerned with the consequences. I think that if we write this, patients won't get it and they'll die as a result. Yeah. I mean, it goes further than that, though. It's because their hypothesis they don't think that tranexamic acid should be given to trauma patients without doing a special test. Now, their research is funded by the company that makes this special test. And actually, they've got a patent on this special test as well. Makes it more difficult, doesn't it?
Conflict of interest.
Yeah. So if they can say that before you need to use this treatment, you need to make this special test, and we sell this special test, it gets more difficult. I didn't realize this at the start. What do you think about all this? What should we do? It hasn't finished, it's an ongoing story, so any comments?
But they did the analysis and you know the result.
Mm.
And it doesn't support maybe their hypothesis, but you know that. So why don't you publish it?
Mm.
Because this might be the concern also not from only his group but other groups.
Yeah.
And US and UK are not the only countries.
Mm.
Maybe researchers in other places could be also interested. And even if you don't publish it yourself, another research group might be interested in publishing it.
Hmm. Yeah, I've thought about that. I thought, yeah, it's just the bother of doing it, but yeah, there's only so many hours in the day, but yeah, you had a...
What I'm suggesting contains more hours of the day, but another form of testing by another party. So one of them seems to have a stake in the matter. So.
Yeah. In physics, what's the approach in physics? You publish everything, don't you? You put it on these websites and things.
Many things, yeah. It's much easier to put things out there because, for one, there's no significant consequence on people right away.
Mm.
And other people will test it, and if you find it wrong, they'll publish right away. It's quite fast.
Yeah. You see, physics, this colleague is a physicist, and in physics they have a different approach to publishing results. They actually, well, tell me if I'm misrepresenting you, but as I understand it, a physicist researcher does some research and then says, right, this is the data, and they put the data out there. And, you know, would they write a long paper, or would they just say, there's the data?
We write a paper as well.
You write a paper as well. But you make your data available
Yes.
so that other people can reanalyze your data.
Mm-hmm. So the actual numbers themselves can be asked separately from the authors quite easily, but usually just graphs. So they'll have to analyze themselves.
So I think that the way that physics publishes research is very interesting, and I wonder if that's how we should do it in medicine, really. And in fact, Richard Smith is the editor used to be the editor of the British Medical Journal, and we wrote a paper together, I think it's about 10 years ago, and saying really that, you know, papers are the wrong way to go. You know, writing research papers is part of the problem. That what we should do is we should write a protocol and make it available on the web. You write an analysis program, you upload it onto the web. Then when your data is collected, you upload it onto the web and flitter, and it just fills up your tables, and it just does your analysis, and you have the results. And you don't write anything. You don't have to write anything. The results just are the results. You don't have to put any of your own biases in there at all. Nobody's interested in that. You just put the results there, and that's it. And so you know, this is what we said, a systematic review is put it on the web. Anybody can comment on it. The statistical analysis plan is pre-programmed, and there's no discussion section or no introduction. It just, you know, just all of that writing papers is a load of nonsense, really. Yeah, so we've published this recently again, that the knowledge system underpinning healthcare is not really fit for purpose. That actually clinical trials are too important to be published, really, because they are, publication is all linked up with doctors' egos and their career. And actually what you've got to do is separate those two things. That actually these are results that matter for patients. Your CV doesn't matter for patients. Your ego or your promotion in the university isn't important to patients, so you've got to separate those two things. Yeah? So you publish the data that matters to patients on the web, and if you want to write papers or do anything you like, you can do that, but it's separate. And so I believe that clinical trials are too important to be published, and that actually the sooner we get away from journals and publishing in the way, the better. Are you going to say, so you had your hand up again? No? What do you think, the rest of you?
It is possible. Publishing is a business, so many people will be kicked out of business.
Many people.
And they're going to resist that.
I'm sure they will. It's a big business. Publishing is the biggest con in the world, I think. I don't know how they get away with it, right? So listen to this. So the public give the university some money, right? The university collects data from patients. The university then prepares a manuscript that it gives to a publishing house that sells it back to the public. It's incredible, isn't it? You know, so the data collection, the research is funded by the public, the data collection comes from the public, and then we give it all to the journal, and then we buy it back from them. Yeah? It's strange, I think. I think Richard Smith talks about this. There's a nice little film about him. He said as soon as the death of journals cannot come quickly soon enough, he argues. What do you think? Oh, I go on too long, don't I? Comments or questions?
Continue with the last suggestion that you just put the result.
Yeah.
And then who has the right to make a conclusion and recommendations? Otherwise, the public patients will not be benefit from these whatever findings you have.
So.
At the same time, I agree with you that it is very strange that we give the data to a journal and then they sell it back to us. This is always strange to me.
It is strange, isn't it? We see this is the result from the Crash 2 trial. I mean, what would you like to say about it? I mean, it's all there, isn't it? It's all contained in these numbers. What else is there to say?
But still, like the physicians, they have their own decision whether to believe this data or not, whether to use it or not. Still, there is always in different part of the world a person, mainly the physician, who will make a decision over patient whether to believe this data or not. And then the question is whether he received this data or not, unless you really announce it out loudly with a conclusion and recommendation, and this is what you should follow. Then
that's
true. The world.
So it's a separate issue. It's about drawing it to their attention.
Yeah.
Yeah.
But with final conclusion and recommendations.
Mm.
Otherwise, you will leave it to different mentality in different parts of the world, and then they will say like, but maybe I should follow, I believe this finding, and then I will follow such and such approach, or no, I will not. I still stuck like this group who doesn't believe with this finding. They have their own hypothesis.
No, I see what you
So
mean.
they want remain negative about this.
Yeah, so we'd have to find a system of. Well, in the UK, what happens is like you get a result, and you've got organisations. We've got one called NICE. It's an organisation that makes clinical guidelines, and it just looks at data and makes guidelines. Yeah.
So
And so NICE looked at this data and said, yeah, this seems to work. We'll put it in our guidelines. So maybe that would work.
yeah, this is what I meant. Like, who has the right to interpret this?
Who has the right to
and
interpret
then,
it?
Announce it
Yeah.
officially to the public.
Yeah, that's true. Any other comments or questions? So today what we've talked about is like, we've talked about these questionable research practices, and they are the selective use of the play of chance and selective reporting of outcomes. And they're very bad for patients because they bias the whole medical literature. And so if you make conclusions based on this biased medical literature, you make the wrong decisions for patients and they suffer. And it's about how we can prevent that. And I've suggested a very radical solution of, you prevent selective publication by getting rid of publication. Yeah? Now, hardly anybody I know in the world will agree with me. They'll do what they've been doing for decades, which is, make guidelines about how you should do things, and write editorials about this is bad, we mustn't do that, but nothing ever changes. It's been the same for the last 20 years. People have been complaining about these things for a long time, nothing's changed. Patu, what would you do?
Tough nut to crack. Yeah, I think the system has been in place for so long, and I don't know what will be the consequence of changing all that. I guess there are a lot of people who live on that.
Oh, yes.
Yeah, so
There are, aren't there? The whole publication game. There's lots of people play that game. And it's got so bad that universities cannot tell who's doing good research themselves. They have to rely on journals to tell them who's doing good research, right? So like London School of Hygiene can't say, look at all of the research and say, oh, that's good research. All they look on, they ask, I have to make a report to my boss every year, what papers I've published. And my boss decides how good I am by the impact factor of the journals I've published in, This is a university, so they can't say, Ian's doing good work, Ian's not doing good work. They can't make that decision for themselves anymore. It's a university, So the only people who can decide who's doing good work are the journals now. So the journals own the universities, yeah? They've completely captured the universities. And so everybody working in a university what's at the front of their mind? Papers. Yeah? You know, in some universities, we talked about this yesterday with Professor Kihara, in some universities it's quality, in some universities it's quantity. Yeah? So if they're employing a new professor here, they might say they would expect them to have maybe 200 papers. Yeah? 200 papers. How, you know, it's a lot of papers, isn't it? So you have a research system that you get people working in places like this, they're not looking for the truth. Yeah? They're not looking for the truth. They're busy writing papers. Get another one, you know? And getting them in English language journals and getting them into, you know, isn't it incredible? Don't you think we should do something?
Yeah.
Should we start the Kyoto Revolution now?
Yeah, there is possibility, I don't know, let's discuss it. When you had to work with your enemy,
Yeah.
and you eventually agreed to their ethic committee to judge, you know, the whole situation. So how about replacing journals with universities? You make some data and, you know, have some finding, but before announcing that or publishing that, you should send it to another university with the ethical committee, and then they make a decision whether this is worth it to publish.
Yeah. It's almost like what happens now, isn't it? Because it's like peer review.
Yeah.
It's like peer review.
But there is no intermediate, which is, I don't know, the journal things.
Yeah. Because when a journal gets the paper, all it does is it sends it to another academic who will review it for free,
Yeah,
and then send it back. Yeah, something's gone wrong. But when I talked to, there was this guy in the London School of Hygiene called Jerry Morris, and he was a great researcher. He invented, when he died at the age of 100 or 99, and in his obituary, this is a sort of what they write after you've died in the newspaper, it called him the man who invented physical activity. And he's the first to show that physical activity is good for our health. Yeah? And he did a really nice study, for example, in London, many years ago, there used to be these London buses that used to have, they're called double-deckers. They have upstairs and downstairs. And there was one guy who sat down driving the bus, and another guy taking tickets, yeah, running up and down stairs all the time. Now, the good thing is they ate at the same canteen, they had the same salary, they were equally likely to smoke, everything was the same, apart from one sat down all day and the other's running up and down the stairs all day, right? And so he did a cohort study comparing heart disease in drivers and bus conductors. And he found that the rate of heart disease in drivers was much higher than in the bus conductors. But what he's told me, I was really interested. He said, we found this result, but we didn't want to publish it until we'd confirmed it in another study. Yeah? I just thought, my goodness, that's amazing, right? Because what he was interested in is the truth of the result. Yeah? He wanted to find something that was true and to publish something that will stand the test of time, you know, that will be true for all of, you know, and it's still true now. Yeah? So he did another study in different group and showed physical activity also reduces heart attacks, and then he published them both. Now that wouldn't happen now. That wouldn't happen now. Now it's like, boo, statistically significant, publish. Boo, another one, publish. You know? It's ridiculous. Anyway, we should stop. So tomorrow I ripped up my thing, but I put it together. So tomorrow we'll look at using statistics to check the integrity of the data. Yeah? Okay. Good. Thank you very much.